people of the territory. Good morning to the testifiers. Good morning to staff and my colleagues. As it relates to Bill 350309, the parcel on St. John that wants to go from R1 to R3, it said it wanted to be, was it multifamily? Is there any, and I didn't hear any opposition, and I definitely saw it was recommended to move forward. I am in full support for any types of projects that is going to assist with bringing home ownership to our shores, but I also want to make sure that there's a happy balance, because when it does multifamily, I always want to make sure there's adequate parking, adequate space, adequate, enough of everything, because we know what multifamily is. It's more than one. So from that aspect, everything was all resolved. No issues in that aspect.
No issues, Senator.
Okay, excellent. 350324, this was dealing with zoning conformity, and that had to do with from R2 to B3. I don't have a problem, because I understand what existing use it has been utilizing for in dealing with the veterinary works over the years, and as well as other types of businesses that it could potentially be utilized for. And I saw it was originally supposed to go to commercial, but the recommendation from DPNR was to B3. So I don't have a problem with that if it stays within the realm, okay? 350327. I think this one had to do with rental office spaces and warehouses, and it talked about west of the Paragon building. The recommendation they wanted was okay as well. I don't have a problem with it. I think a lot of these projects that I see coming online, when I looked at the maps and the locations, I didn't have a major issue. I just want to zone in a little bit on 3503.
It was a Thursday. I bought a vape pen, an
05, because that was the only one I saw that had quite a bit of opposition in regards to reasons why. And I see one young man came in support of it that's adjacent to the property. One of the things that was listed here as an opposition from two individuals that are in the surrounding area, road loading is subject to property passing 11 lots occupied by the elderly, small children, pets, and large grazing animals. Long-term residents would be unable to accommodate visitors with vehicles, walk their pets, or sleep peacefully at night. Could somebody elaborate on that? Because I don't want it to be an exaggeration, or is this a real legitimate concern? Because I get very concerned when things are zoned for one thing and then we come in and rezone them and potentially affect people around us. So could somebody help me with this number 4, because that was a huge concern for me.
Yes. Honestly, that statement was very confusing to me. I'm not sure what it entailed. There was a lot indicated during the public hearing. And just to clarify, and not to minimize, but we did have one of the testifiers is one that does not own property in the area, nor does she reside in the area, but she helps to operate a horse training or horse riding facility in one of the nearby slots. And then there was another, so she expressed that, so I'm not sure. She doesn't reside in the area, so I'm not sure where that comes from. Perhaps Mr. Jones can elaborate a little bit more than I can.
Sure. Good morning, James Jones. So, to add to what Attorney Jones was saying, pertaining to that individual, correct, she doesn't live there. She basically just cares for the horses and provides some type of horse riding guiding tour. Essentially what happened, since we acquired the property and started planting the fruits and vegetables and so forth back there, the horses used to graze on our property. So we made it clear to her that, hey, you need to cordon off or at least have more control of your horses, because their barn is a fenced area, 2-acre lot fenced area. but however, they come out over and outside.
They
as you
were
can see.
affecting what you were doing.
Exactly,
Okay.
100%. So have the discussion politely, requested that, she stop it and so forth. And it happened a few times where it killed some of our crops, some of the orange trees and different stuff that we had planted and so
right.
forth. So when we did post the actual
1 minute,
notice,
30
to DCNR,
seconds.
She was
I
there
didn't
front
see
and
it,
center.
correct, and I didn't see it, but it was torn up the day thereafter
Okay.
when I returned. So that's
Okay,
basically it.
I think I'm getting the grasping what's happening here.
Correct.
Okay, the other thing I wanted to talk a little bit about, what percentage of this property are you going to at least leave for agriculture? Because I do understand sometimes you don't need nowadays with aquaponics, hydroponics, you could greenhouses, you could literally farm what you could have done on 40 acres, maybe on an acre nowadays. I'm going to be honest with you. The technology has advanced that much.
Right.
So what percentage are you still going to leave for agriculture? Because I saw you wanted to do additional things, the water business, retail, but I still like the fact that you want to stick to some agriculture part of it.
Yes.
30 seconds.
James Jones again. Yes, so as it is, the 3 acres will be minimum, will have at least 3/4 of an acre
Okay.
remaining for such services.
I love that.
Yes.
Excellent. That's all I needed to know. I am in full support of all 4 of these particular rezonings because each one of them were clear and concise as to what they wanted and what they're potentially going to bring to this community. So I'm definitely in support, and thank you, Mr. Chair, for the time.
Thank you very much, Senator Francis.
Good afternoon to my colleagues. Good afternoon to the people of the territory. Good afternoon to the testifiers and staff. My first set of questions has to do with providers. As you know, that this is a very interesting situation with having in-network and out-of-network providers. As a user of my insurance, that is the very first question I ask when I call any doctor's office. Are you in or you out? Because I know that's the difference between costing me more money or less money. That's my bottom line. So have you guys seen any uptake, or have you guys done any situation of trying to have more people in network to really assist with making sure these costs are actually lower as it relates to the employees of the territory? What are you guys doing in regards to that?
So I'll start off by, in territory, there would be very few, if any, providers that are out of network per se. Once we get off island, I have to, if you're talking about Cigna, I'll refer to Ms. Dipali Saeed to tell you what her statistics are. And coming towards United Healthcare, I'll ask Ms. Linda Jones to
Okay,
answer that
I'll
question.
listen across the board.
Okay.
Good afternoon, Dipali Sai, Cigna Healthcare. May I pass this question to Dr. Vitiello, our medical director, who works very closely with the VI EchoCare network down here?
Yes, this is Dr. Marco Vitiello with Cigna Healthcare. To the previous response, we definitely have a strong in-network presence here on island. Out of the island, of course, it does vary depending on where in the United States, but a very high penetration of Cigna connected doctors. So it is very, very likely that customers will go to in-network providers unless there are unique locations or unique illnesses that require a super specialist of some sort.
That they would have to leave off island.
Correct.
Okay, so for your part, do you think overall, based on information with Cigna, that for the issues that you might have claims for, the majority of them can be serviced here in the territory with in-network providers? Or what percentage do you feel might have to travel outside based on what services are being provided?
In-network providers are ubiquitous on the island. That,
Okay.
there's not a problem. In fact, in certain disease states, such as behavioral, we have increased dramatically the number of providers, and that is a big economic line item, frankly, and it has gotten worse in 2023 and 24. So we've bolstered the network to supply that, Dr.
Definitely. And I'm happy you brought that up, because even with myself, I'm dealing with that with a family member who's also on the insurance. And one of the issues that we ran into with this family member is getting their medication to keep them balanced. And the doctors recommended one type of medication, but they said the one they really wanted to give him Cigna doesn't approve it here. How does that work in regards to certain particular types of drugs being approved in the US, but then here in the territory, our residents can't have access to them? Because I think, for example, with this one particular drug, Cigna said it was too expensive here to approve it, but this same patient can get it stateside and get it approved. I'm trying to understand what's the difference between being here and versus being in the US.
To be perfectly frank, there shouldn't be a discrepancy. I do have a pharmacy colleague here. The medications.
Make sure you say that on the record, like, really.
I would have to know the specific medication. There might be a unique situation with a given medication, but the policies are the policies typically. And so the way, what you're describing is perhaps a little different, where there are rule sets where a medication might be requested and a generic needs to be tried first, or there's a step program in place. And again, my pharmacy colleague might be able to be more specific on how that can be utilized. But that's typically to make sure that a customer is getting the most cost-effective medication. A lot of times doctors and even patients come in requesting medications that might be very, very, very costly and not necessarily the best medication for their particular illness. They saw an ad on TV, or the doctor just got, talked to by the rep. So it is very important that we follow what's called evidence-based set of protocols. So we go through certain steps. So again, your specific example might require a little bit of a deeper dive, but I'll let my pharmacy colleague talk a little more about the specifics of the STEP program.
Good afternoon, Mina Ayad, pharmacy consultant. So what Dr. Vitiello was referring to is there is not a discrepancy in regards to stateside versus on island. What the discrepancy may be referring to is each medication within the pharmacy benefit, if that is what you're referring to, has its own set of criteria in order to go through the paid claim experience. So in order for a prescription to process, it would A, have to be on the formulary, and B, have to have met the requirements that are necessary for that medication.
Okay. I just want to clear this up. A family member that's on my insurance was specifically told they cannot get, they cannot get a specific medication because it's not approved here in the Virgin Islands. We were specifically told that unless they go to the United States, where there are cheaper and it has coupons and it has all of this, that would be the only way it could be approved for them. So what you're saying to me is contradictory to what was said to us. So that's why I'm a little bit confused. So I heard what you said, and I will deal with that another time. When it comes to mental health and wellness, I know you said you have done a lot of uptake with that because of what's been happening over the past couple of years. Do you see that there has been a benefit in regards to that in helping the employees that do have Cigna and the other services here in the territory?
Based on utilization
Yes.
data, that would appear to be the pattern, yes. More utilization as a result of having a more robust network, and that's a good thing.
That's a very good thing. Could I just wrap up, Mr. Chair? Thank you. I am a full supporter of making sure that you take care of your mental health. You know, we spend a lot of time, you know, we got heart issues, we have this issues, but everybody forgets sometimes the mind controls everything. And if that's not taken care of, it can affect everything else. And my last question, I wanted to ask also about other preventative measures because of the van that goes around. I participate in that. I have to say, I love the nurses that I worked with this year. I give you guys extra credit for that because I did learn a couple of things that caused me to go buy a whole slew of vitamins I didn't know I was missing from my diet. So I will give them credit and give you guys credit for that. But what I also will say, from a data standpoint, have you seen any improvement across the board as to the reduction of what your cost outtake is since you guys started to implement these vans here in the territory and doing this preventative type of checkup on an annual basis?
Good afternoon, Dipali Sahi Cigna. So, Madam Senator, for the period of October 1st through August 31st, 2024, we completed a total of 2,098 biometric screenings just in the van alone. In addition to that, there was 4,458 screenings that were completed in total amongst the active population, which included members taking the initiative to seeing their physician or their PCP by themselves to get those biometrics screenings. To answer your question, whether it has seen a reduction, I think the trend would be a little bit more forward, because today we are trying to quantify something that is very prevalent in the society, in the membership. So as these folks continue to keep their basic biometrics done, at least it will help mitigate some future potential larger illnesses to occur. And we haven't seen a difference yet, but we do know that if we continue this trend, there is definitely it's going to help.
Okay. Thank you so much. Mr. Chair, I do appreciate the additional time.
Thank you very much, Senator Francis Halliday. And I don't want to take